Do you want to know how Big Pharma created a market in Japan for their antidepressant drugs in the 1990s? The story might make you think about antidepressants and SSRIs differently. So, this in particular is about Paxil and GlaxoSmithKline, and it all begins because of a cultural psychiatrist, Dr. Lawrence Kermeyer, was invited to this conference in Japan to study or to share essentially like how culture and psychiatry work. And this was a conference put on by GlaxoSmithKline that brought together world leading researchers. And they were studying how to position their drug Paxil in the market from these individuals because they weren't currently selling their drugs. And Japan didn't really have a word or a concept of what depression was. So they were inventing one. And after this conference, he went away, and the story picks up when a cultural anthropologist, Kalman Applebaum from UW of Wisconsin, Milwaukee, and he goes out to all these big pharma companies and then starts talking about how they rolled out this drug. And he finds out that they were very open book and told him all of the strategies that they used because they thought he was, a researcher who could help them. So he goes to talk about how they first needed to essentially convince the public that they had a disease that there was a disease that they had a drug for. So in Japan, the concept of depression only existed as what's called utsubio, which is defined as like really severe depression, meaning you're suicidal, you're psychotic, you're the very small percentage of people that cannot function because they're so depressed. They didn't have this idea of what we have today, which is, you've been feeling blue for 2 weeks or, a month or whatever, and you can't get out of it. This kind of general idea of like you're weighed down by the burdens of the world was actually viewed in somewhat high regard in Japan, which meant that you were striving in your world to like reach, do your obligations and duties to the people around you. So if you were, sort of under pressure and suffering, it was like somewhat revered. But Glaxo and the rest of the companies that colluded essentially to create this market needed to change that narrative and come up with a way to convince people that, well, actually feeling down and feeling blue could be a symptom of something called depression. So in 1990, before 1995, nobody really would have ever thought of taking a drug to manage, the definition of depression that we have today. So they started with engaging, kind of the researchers, and they rolled out a bunch of studies that showed that their drug had an impact. I happen to question the validity of the chemical imbalance theory, which the entire SSRI world drug class is based off of, but they were pumping out this research, getting it into people's hands, and they were trying to circumnavigate the regulatory environment in order to get direct access to consumers. It was stated by the pharmaceutical executives that they were trying to create a consumer-driven market. So they were trying to recruit subjects for their drug studies to test this drug, and they were creating media content that was around like articulating a story about how depression exists in Japan. And all this was happening when a very critical point occurred. There was a man who killed himself, and it was because he was working so much. And this became a media sensation because his parents sued the company he was working for. And so for the first time ever, the idea came up that, working hard could be a contributing factor of this thing called depression. So pharma got on that narrative that like working too hard, feeling down is a symptom of this thing called depression. And if you're doing that, you need to take this drug. Put out a bunch of content in the media, changed the conversation, and eventually a word was developed, and it was called Kokoro no Kazi. Kokoro no Kazi means coldness of the soul. And so this was the new term that was invented to describe what, feeling blue, today's modern definition of depression, is for Japanese patients or Japanese people. They blasted this all over, and all of a sudden people were showing up at a psychiatrist's office saying, give me this drug that the Americans that have figured out, how to solve depression. And this was because, work in particular was a significant driver of suicide in Japan. So, whereas suicide used to be revered in Japanese society, now they were like, oh wait, it can actually be an external force that is somewhat responsible for your internal world. And that case was the first time that idea was implanted in the Japanese psyche. And that idea in of itself is like a very Western approach towards dealing with interpersonal struggle. We tend to believe that these things are external to us, whereas the Japanese typically were more of like a collectivist approach, where they thought that they were doing their duty if they were carrying burdens, and that was all sort of related to the choices that they make and the group of people that they're around in their environment. The idea that it wasn't something that was in your control was not part of their culture until the marketing engine of Big Pharma implanted that idea, and implanted the idea that their drugs solved that problem. And what do you know? First year sold $100 million. Paxil sold $100 million. 7 years later, in 2008, I think they sold $1 billion in Japan. So this apparatus of finely tuning, of creating markets, creating needs for mental health medications in other cultures, is a very finely tuned team in Big Pharma. They are very talented at what they do, and they're very successful. They look at countries on a maturity scale, the US being the most mature in terms of their willingness to accept the medicalization of the human experience as something that can be treated with a drug or by a medical professional. And they are aggressively working to try and convince other cultures that we've got the answers. And frankly, I've just had enough of it, because this has been happening for the last 20, 30 years, and frankly, the issue is getting worse. So I don't know why we are still allowing this to run rampant, because 1 in 4 Americans today takes a mental health medication. You would think that would lessen the impact, but all we hear every single year is more and more and more people have mental illness. And that's because people are telling us we have mental illness so that we will take their drugs. And this is not going to stop until every person is a potential consumer. That's just the way our capitalist society works. So you just want to be aware of it, that there is a likelihood that you're being influenced by the media, by the diagnostic tools that your clinician is making, which are highly subject to the funded research coming out of the drug companies, the information that they receive from the drug companies regarding the effectiveness, and I'll do another video on the kind of SSRI chemical imbalance thing if you're interested, but influencing these cultures. And there's another story that I'll tell about the anorexia epidemic in Hong Kong, which was also another kind of Western created idea. So if you like this content, let me know in the comments, like and subscribe, or if you want to have a more intentional conversation and share some wisdom, you can find me on Avalo Chat, where I'd love to hear what's going on in your life that matters, and have a discussion about how we can come together as a community, because what you see in the Western cultures is the eroding of this cultural component of let's support each other and get through this. They're exporting that ideology, but I think that's a mistake. I think what we really need to do is bring back the community support of our people, and not destroy those bonds, and create places where people can go and talk to elders or more respected members of their community, or people who have certain wisdom and experiences. And so we're trying to create that environment online, and we'd love it if you give it a shot and join us.